Hello, hello. 1, 2, 3, 4, 5. Welcome to Southern Caregiver Resource Center. I'm Marta Rañón, and I'm going to be talking to you about sorting through the healthcare documents. We also have our viewers online, and so again, this is available to you afterwards to view as many times as you like and to share the link with others who might benefit from this class. We might be getting some questions from our online friends, and that's fine. I'd encourage you to do that, and my staff is going to be monitoring those and sharing those with me so I can ask and respond, or they can ask and I can respond. But then also I make sure that if you do have a question, if you have a comment, just be a little bit loud so that we can, they can hear you. Sometimes they're interested. What did she say? What did he say? So let's get started. How many of you have an idea of what we're going to talk about? Good, good. Some idea, right? These are some of the questions and these are some of the topics that we get asked a lot. And being that it's the beginning of the new year, I think especially during this time. Because what just happened? What did we just go through? The new year? What else?
Lost documents.
Lost documents. You're cleaning your house? We just spend, oh, he's keeping you busy.
Time with family.
Time with family, yes. So we just spend the holidays together, right? With family, with friends. And this is around the time that we start noticing things, right? You might have noticed things that were different, maybe a little different, or maybe a lot different. Maybe you started noticing that, mom kept repeating things over and over. How many of you are caregivers, by the way? All of you, yeah. So maybe you started noticing that, dad or your husband or your wife started hiding things and not understanding why, or asking the same question over and over, or getting confused. Where are we? Who are you again? Right? So you start thinking, wait a second, there's something going on. What is going on? And so you all raised your hand about being caregivers. So that means at some point you're going to be making a lot of these crucial decisions. And what we are trying to do here with this class is empower you to be able to make those decisions with the least amount of challenges as possible, because it will be challenging, right? You are the advocate for that person, and sometimes there is a limit to what you can or cannot do. But the documents that we're going to go through today should help you a little bit more, okay? So if you have a notepad and pencil or pen, great. If not, we can, raise your hand and we can give you some. Great. Because what we want you to do is we want you to take notes. And we have handouts here which I will mention for the sake of our viewers and let you know where you can get them. But if you have copies, you can write on them if you like, take them with you and share them with others. You can get additional blank copies if you want to take them home as well. So you can maybe write on one or have the other one blank if you want to work on that. So, and then one more person here. Okay, so she'll get that to you. Any questions so far? Okay, ready for the write together? Yeah. Okay, good. Okay, so this is what we're going to do. We are going to talk about the different healthcare documents, because there are many. We are going to try to understand as basic as we can what each does, and then know when to use each document, okay? Full disclosure, not an attorney, not an elder law attorney. So I'm going to show you what these forms mean and how you can use them. But if you have very specific questions to maybe your particular situation, then talk to me afterwards, because I can put you in contact with some of our partners who are law firms and attorneys that can get to the specifics of your question, okay? All right. So how many of you have taken a trip ever? Okay, so what goes into the planning of that trip? Shout it out. Maps. Expense. Budget, right? Research. Where are we going? Is it hot? Is it cold? Calendar, right? Appropriate clothing. You have to go shopping. Money, right? There's also the excitement, right, of planning. But that's the key word, planning. Right? We plan for maybe as extravagant or as intricate a vacation, or maybe as simple, I'm just going up to LA for the weekend. Right? Got to gas up the car. You still have to get your clothes, pack an overnight bag. Right? You're going to stop along the way. So you still plan. But many of us don't plan our lives or our future or even end of life decisions that way. Right? We don't even think about it. But it is something that we should plan, because as you plan those activities, it makes it easier, quote unquote, to make those hard decisions later on. And if you already thought about it, if you've already had that conversation, then if you're ever faced with having to make those difficult decisions at that moment, guess what? You already have a plan, right? So just like a trip, and if you say, wow, what happens if I get a flat tire? Oh, I got AAA, right? I'm going to plan to use it if that were the case. Or I can call my brother or sister and they can come and get me. So you have a plan, 3-page document. And for our friends online, you can find them on a website. You can go to, I believe, like Office Depot and Staples and get copies. They're blank copies. Okay, you can fill them out. But you can also use these Yes, the one that has 3 pages. The one that's stapled. That one. Oh, no. Oh, she'll give you a copy. Yeah, it should say Advanced Healthcare Directive Form Instructions on the top. Yeah, I have 3 stapled. Yes. Okay, everybody have one? Okay. All right. So the instructions are actually on the top, so you can definitely follow along, but I like to talk about it because sometimes it's easier to do it together, okay? So flip the page. Technically, we're going to start on page 3. So it's where it says Advanced Healthcare Directive. And, you know, you can fill it out. It says name and date, right? It's really simple. We can do that. But now we get to part 1. Okay? And part 1 is where we're really talking about who we're going to designate as an agent. What does that mean?
Who's going to speak for you?
Who's going to be your advocate? Exactly. Who's going to speak for you? So if you are the person that is being taken care of, who is going to be my voice when I can no longer utilize my voice? Right? So again, putting yourselves in the role of the caregiver, but you could also use this for yourselves, okay? Okay, so who is your agent? So right now, make a note somewhere. Quickly think of who you could make that person to be your agent, okay? So you may do a column that says, for me, who would you want to be your agent? Maybe you put 3 names. Maybe you put a primary and 2 alternates, and we'll talk about that. Okay? And this is going to be part of your homework. And now in a second column, as the caregiver, right? So you're here because you're caregivers, and you're worried about the health care and well-being of somebody else. So as the caregiver, are you the best agent for that person that you are caring for? If you are, put your name down and put a little star next to it. Okay? Underneath your name, because a lot of you were nodding yes, consider putting an alternate. Who else in your family could be an alternate for the person, for you, should you be unable to, for whatever reason, maybe you're traveling, right? Putting to good use the maps that we talked about. Maybe you're working. So who could also be an alternate for the person that you are caring for? Okay? And I know you haven't talked to these people, or maybe you have. But if you haven't, that's what the conversation is going to be about. Okay? Because an agent should only be one person. Why is that, you think?
Less confusion.
Yes. So they don't fight and less confusion. Absolutely. I have heard the story of, someone who's who's a care receiver, is what we call them, and they have 3 children, adult children, and 2 of them want the surgery for the mom, and the one does not. And now the doctor has to make a decision. Who do you think is going to outweigh? The one, right? That's the agent. Even if there's 2 siblings that don't want it, but that agent says, well, as the agent, I know my mom would want it, so that's what we're going with. If there is no agent designated, then it creates that conflict that we're talking about. Because then who is outweighing who, right? Who has the ultimate authority? And that gets really problematic. Because now if you have those 2 people that say yes, and you want to have that person that says no, but there is no healthcare directive, the doctor is going to have a hard time figuring out what to do there. And he or she might say, well, we really need to have the surgery done. It's to save your mom's life. And now what? Right? So it's really important to designate that agent, and only one. That agent needs to convey all of the wishes of the party that is being taken care of, right? That benefits from this document. And I say that very carefully, because just because that person has a wish, but you don't agree with it, how are you as the agent going to come through with that wish? Are you going to be okay with still making that choice, or are you going to be conflicted? So I was a family caregiver. I used to care for my great aunt who had dementia. She was 93 when I became her caregiver. And she had very specific wishes, which were different than mine. Very different than mine. But I knew it wasn't about me. It was about her. So I needed to honor as best as I could her wishes given the circumstances. So this is what I'm saying. So if you are on that column, your name is on that column that has that little star, if you are okay with being that agent, then you might consider proposing it to your family. I can do this. But if not, then who else can? Okay? And then on your other side, right, as the person that would be benefiting from this form, so if you were the care receiver, who do you think out of those people that you put in that first column, who would execute your wishes to the best, closest to you? So you might want to put a little star next to that first column, right? Who would you want that person to be your agent? Because now you need to have a conversation with that person, right? Does that make sense? Okay. You could have an alternate, which we would suggest, because, we travel, we have activities, we might be sick, we have, work. So we might consider getting an agent for ourselves, but also having another agent for the person that we are caring for. Okay? Especially if the person that we're caring for lives in another state. If that person lives in Florida, the care receiver, and the alternate lives in Florida, but I am the agent and I live in California, we might consider switching the roles, right? Because that person is there and is able and is already an alternate, so that person is already going to fulfill the wishes of that individual, but this person might not be able to get there on time if they need to make timely decisions. So you might consider switching that, okay? This first part also talks about determining the authority of that agent. What is it that you want this person to do for you? Right? This agent. So if you flip the page to page 2, it talks about, you can say, well, I want my agent to start making decisions for me starting 2019. You can be very specific. January 1st, 2019. Or you can say when I hit 60. Or you can say once I start living in this place. Whatever, you can be very specific. And it gives you options here to fill that out. Align. Okay? Part of this area also talks about full or partial authority. Is that person going to be 100%, that agent going to be 100% responsible? Or only should I not be able to make those decisions? Right? If I start having memory issues, that's when I want my agent's authority to become activated. Prior to that, I'm in charge. Right? So that's where you would determine that when it begins. So this is a lot to think about, right? And that's why you have to have this conversation with the person you're caring for. Or if it's for you, something for you to start thinking about now and having those conversations with the people around you. Okay? So feel free, again, to jot down notes if questions that come up. Yes?
Who determines when I am no longer able to make decisions? Do you have to have a doctor's note that says, yeah, this woman is compromised and is unable?
You could make that the point. You could say, I've noticed that I might start forgetting things. And as we go to the doctors and neurologists and we get evaluated and assessed and they determine, yes, there's some memory loss, then maybe that's when you decide to activate it.
My question is, I've already put it in paperwork that when I am no longer able to, but I'm afraid that a patient may say, oh, no, 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 I can do this. Who determines?
You could put that there. You could even say, after a physician's review, diagnosis, if you have already your doctor that you're working with, after he or she determines that I can no longer make decisions on my own. You can be that specific. If you're afraid that somebody's going to step in when they shouldn't, that could also be, something that you jot down and you share. Yes?
This last weekend, I spent reviewing just that subject on the internet. There is a lot. Just go on and ask for how, determining mental competency. Competency tends to be the word, but there's lots of other things. But go on the internet and Google that, and you'll find lots of stuff. And I'd be glad to give you my email so I can send you stuff if you want.
Oh, I love that. Thank you.
Because there is a lot, and I read a lot, and I learned a lot.
And also talking to others might help. When did you have yours activated? When did your mom started activating that? It's usually the people that are around them and their caregivers that can say, okay, well, we started it when we started noticing these problems. That's when we stepped in. Okay, and then here, so again, page 2 talks about the obligation of the agent. What is it that you want the agent to do? And it sounds very vague, right? I'm not giving you very specifics because your situation is unique and your family dynamics are unique. And your wishes might be very different now even than they were before. Now you might be more aware of things and might start saying, well, no, I really need to reconsider. I want it when we go and measure our mental aptitude and to see if that's when we should activate it, right? Okay. So we now go to part 2, and it's still on page 2. And part 2 is talking about life-sustaining measures, okay? So I know these are difficult conversations that we're having, but they are very much founded on being prepared. And that is the ultimate goal, is to prepare for what might come ahead. So in this case, we're talking about what kind of treatment would we need or would we want, especially as it involves end of life. I know it's a topic nobody wants to talk about, but it is very real, okay? So if you look at still part 2, page 2, it's very simple. Do you prolong or do you not prolong? And you decide. You don't have to answer it right now, but you really can think about, well, this is what I would want for myself. And then just be very specific. So again, jot down notes if thoughts come to your head of the kinds of conversations you want to have with your family. Okay? The second, let me go back. If you flip the page 3, 2.2, area 2.2 right here, it talks about if you have other specific desires, wishes, choices to consider. Okay? So if you're very specific, instructions. And you could always add more. I know they give you a couple of lines here. You could always add an additional page and say, if this is the situation and so is here, I want you to do this, this, and this for me. And, and if you already have some sort of condition or illness that is very specific, then you might even address that in this section. Okay? That make sense? Okay. Part 3, donation of organs. Now, I know this is sometimes a question that a lot of people are not sure about, or maybe they are very sure, and one way or the other. On this page, page 3, it gives you the option, right? Certain organs, tissues, parts, or no. It's optional. What I would suggest is that you still have this conversation, whatever your decision is, to let those people around you know. Okay? You don't have to fill it out. Or you can put, you know, I do not wish to do this now. But at least they know. Mom wouldn't have wanted this. Or yes, she would have wanted this. Or very specific. You know, these are the types of body parts that I would want donated for research, for life-saving measures. You can even include all that here. Okay? Part 4 talks about the primary physician. How many of you have a physician that you've had for years? Okay, so a lot of you do, okay. And you know that doctor, and you've established a good rapport, and you like the way, you know, they know everything about you, and so it's really easy to just come in and work with that doctor. You could put his or her name here, and as you can see, it takes very simple name, address, phone number. You might even add email, right? But here is something that I want to share with you. That is assuming that everything's normal, right? That you just go to the physician to visit on a regular basis. What if you're out of town and something happens and you get sent to the ER? Is your physician going to be there or available? Or you're in another state or in another country? So if you put that information, know that it might not be very easy to get a hold of this physician. So you might have to just allow whichever doctor is there helping you to work on you, and then they will, you know, maybe request, let my doctor know, which oftentimes they do anyway, but just to let you know that don't be kind of holding on to the idea that only your doctor is going to see you wherever you go, because that might not be the case, okay? If you are traveling, like I said, if you're out of town, maybe you visit family on a regular basis, then just think about that not being so readily available, okay? So that's why I put here is optional, okay? You could also say, put a little note that says, I understand that, you know, I would also want whoever is available to treat me first, and then let my doctor know. Here's this information. You can put that. Okay, signature. Right, we're almost done with this form. We're almost done. So page 3, signature. Quiz, optional or not optional? Good. It's not optional. You got to sign it. Okay? Oops. You got to sign it. And that's why here it's got, you know, your name, your date. It should be witnessed, and if you turn the page, it should be witnessed by, you can do it different ways. You can have a notary public, right? They do it in front of that person, stamp and seal, ready to go. Or you can have it witnessed by 2 people that are not, hopefully not related to you, so that there isn't this idea that they're cajoling you into signing this. And it's right here on page 4, so the back of this packet, as you can see right here, you could put there. So you could talk to them, you know, ahead of time. I'm trying to complete my form. Would you mind? I've known you for a couple of years. You're my neighbor. You're my friend at church. Whatever it is, could you, you know, be my witness? They don't have to do anything other than attest to the fact that you are not being, you know, cajoled into filling out this form. Okay? Yes?
I've had a situation where it came to me loud and clear that anyone who's treating the patient will not sign that.
Yes. So that, yes.
So you need to make sure that you, oh, well, there's plenty of people around, and these people all know what's happening with my loved one or something like that. No. They
Yes.
won't sign it. So you really do need to do it ahead of time.
Yes. So it actually takes me to part 6. And part 6 talks about that, let's say the person is being treated or at a residential facility, no one from staff can be a witness. So you would still have to bring somebody independently, non-affiliated with that facility or that organization or hospital that's treating you. Okay? And that's it if applicable. If you do it ahead of time, then it eliminates that hassle of getting a witness. Okay. So when should you update it? I kind of gave you the answer already. So if you have one already and you haven't updated in the last 3 years, it's probably a good idea to update it. But definitely if it's been 7 years. And the reason for that is what? Things change. Relationships change. You might move. Your ideas and how you feel about those requests at the beginning that we talked about might change. So if you have already talked to those people that you wrote down and it's been 7 years, maybe it's time to revisit that conversation and say, you know what, I've thought a lot about this now, and this is now how I feel. Yes?
Oh, so you're just saying that you just discussed this, but you don't have to go back to your lawyer and redo all the paperwork again.
That's actually what I'm saying. And the reason for that is because diseases, progress. Physical, mental aptitudes change. We definitely want to make sure that everyone's on the same page as we are progressing, maybe with treatment or a disease or the care of that person. Okay? Let me give you some scenarios. So I talked to this woman who had her husband was her agent. Okay? Pretty simple. She was married to him, and, he took care of everything, and they went through life, and he gets Alzheimer's. As she's caring for him and doing all of this, she realizes he was my agent. There is no way he can do any of this that I am required. I had required him. We had signed and agreed to. So now she had to go look for an agent to be her care, right?
But she already has the second agent, remember?
Yeah, and if she did, then she can definitely, but she would still have to talk to them. What if they're no longer willing to be the agent? So, because we get busy with our lives, right? We move on, and we're caregivers, and we do everything that we can, but we kind of forget about us, and then things change, and now it's like, we need to dust this out, and we need to start all over to make sure that things hadn't changed. Give you another scenario. Talking to a person that actually used to do a lot of these talks, and said he was going to Boston to do a marathon, and had adult children. And the last thing he said before he got on the plane was, here is my updated healthcare directive. So the sons were kind of like, oh, Dad, But it's like, no, I've actually changed some of my thoughts on certain things, right? And even it could be as simple as, it doesn't have to be this thin. You could add additional, you can even talk about funeral arrangements, right? I want these songs. Okay, now these songs I don't want. I want these new songs. Or I want to invite her, but never mind. I don't want to invite her after. I'm just kidding. So, things could change. So you might want to include those as well. Okay? So yes, think about updating those documents. And now,
What would happen if it's outdated and then you do end up needing it? Things.
change.
Yeah.
So this copy, and again, you could use this. You could fill it out and go get it notarized, and this would be good to use, good to go. The latest copy is your most recent. So if I had this one done in 1985 and I do one in 2019, that one's done. 2019 overrides that one.
Yeah, but what if you did one 8 years ago?
Mm-hmm.
So that's outdated.
It's not that it's outdated. It could still be used.
Okay.
But as long as things haven't changed in terms of decision making, people's abilities to execute your desires, your wishes, your thoughts on end of life treatments, whatever it is. As long as those things haven't changed, you can still use it.
So that's just more a recommendation to update it
Yes.
okay.
Yes.
It's not that it's null and void
No.
after 8 years or something.
No. It doesn't become void until you update it. Yes.
Are you also trying to tell us that it can be contested because it's over 7 years? If nothing has changed,
Again, not a lawyer, but it's not, as long as, if nothing has changed and everything stays the same, you could still use that one. If somebody were to say, oh, I have a copy from Wendy from 1985, and then Wendy's daughter says, but I have a copy from 2017, they could say, well, no, because she talked to me, and I know that this is the actual, I was there. This one still is the more updated, so this one's the one that would be more valid. Yes.
So once you update this healthcare directive, do you just make copies of it and give it to
Yes, thank you. You are just helping me move this along. I love it. So yes, so my suggestion would be those people that you wrote down the names, you would give them copies of this original packet. Here's your copy, here's your copy, here's your copy, right? So maybe you have an agent and 2 alternates, whoever they are. They could be your friends, they could be your neighbors, they could be your family, your relatives, whoever it is. You keep a copy. You give one to your doctor, your physician. Maybe it's the people, the doctors, the physicians, the people that you go to on a regular basis so that they know what your wishes are as it relates to your health. Okay? What I used to do with my aunt is I used to have several copies so that if I needed to rush to the hospital, I wasn't going to be able to go home and look at my file. I had one with me.
someone suggested to also take a picture of it on your phone.
Now that we have the ability to do that, it's even great. But nothing, to have that form is sometimes a little easier. Even if you do make copies, it's still valid.
You could also email it to yourself and save it as a PDF and then
Yes.
you can forward to any
Yes.
facility.
You could do that. Yeah, absolutely. Yes.
So, just to repeat, so if there's so if you have a copy with a signature and it's a copy of a notarized, a document that was notarized,
It's just as good.
still valid?
Yes.
Okay.
Yeah. Which leads me to the next challenge, right? Let's say you've done 10 of these and they're scattered throughout your family and friends and doctors and your car, I guess. I don't know. And you're going to change it. You should go back and collect all of those copies just to be on the safe side and then reissue them the updated copy. And talk to them about it. This is why we changed it, so that they know. I'm changing this end-of-life care treatment. This is why I'm changing it. And get it notarized or get it signed and witnessed and get your, okay? It's very helpful to get the people that are going to be involved with the care copies and to let them know. Okay?
I find that it's probably easier to get it notarized.
Yes.
Have the witnesses,
Yes.
because like ours is over 20 years old, and those witnesses are, I don't know where,
See?
and the like. And so I'm gonna have this notarized, and I can go to AAA or some other notary or whatever and get it notarized, because then I don't have to worry about it.
Absolutely. And then if ever something were to come up and they say, well, no, I'm the agent, I have it. And it's like, no, that one's an old copy. I have the most updated.
So it's either witness or notarized?
Yes.
Okay,
Yes.
great.
Okay.
By the way, if you go to the bank, they'll notarize it for free.
Yeah, they'll notarize it for free.
That's great. I didn't know that. That's great.
You have to
If
pay
you
AAA.
have homeowners association, that's where I go.
Oh, great.
Yeah, 'cause
Wonderful.
any organization like that does have a notary, and you can
Perfect.
get it done easily.
That's great. So
there are
good.
lots of things you can do to get involved.
Get it notarized. Yes, wonderful. Okay, DNR. So DNR, and I think it's the page that is 2 pages stapled together. It says emergency medical services, pre-hospital, do not resuscitate DNR form. Okay? You have that? Okay. DNR. What does that mean? And it's also something to really think about. Because I know that sometimes we want everything possible to keep that person alive and to do all of the measures necessary to bring that person back to life and health. As the agent, or as the caregiver, or as the person who is going to benefit from this document, you really got to think about what would it be like under certain circumstances. Okay? DNR is a way for you to kind of have a choice when doctors have to go in there and do everything possible to save that individual or to save you. And this is where your personal opinions really have to come into play. How do I want to be if the outcome is worse? How would I feel if, as the agent, the outcome of the person that I am caring for is worse if they do everything possible to save that person? And what I mean is that, I had to consider if my aunt would have gone into cardiac arrest and they used the paddles and that force that is used to jolt the heart back to keep working, things get broken. Things get, pressed and would the outcome would have been worse for her at 98, right? So I really need to, I had to have that conversation and think about it. So what does it do? It's an order written by a doctor, pretty much talking about letting other healthcare staff, hospital know that they are not wanting any life-saving measures. Do not resuscitate, okay? It's very specific form that doctors would know. So my suggestion would be to let the physician know, whether it's for you or the person you're caring for. We have decided DNR. Or we have decided do not. It's up to you, okay? What it does, and what it doesn't do, I should say, it does not, as you can see here, CPR, right? So CPR is like the first form of life-saving measures that would be used. At that point, you can say, no, that's not something that I want done. Not the electric shock to the heart, artificial breathing devices, other invasive procedures. You don't want any of that, then DNR. And that's why this form is important for you to, and as you can see, it's very simple. You would fill it out, sign it, date it, and my suggestion would be to keep it with your healthcare directive, okay? And that you talk to those other alternates and those other family members. This is what we have all decided, and this is what we're going to give the physician. You can give the physician, let the physician know, talk to them about that, okay?
Can I?
Yes?
I had a situation with my mother-in-law, which just broke my heart. She had DNR. The person who was taking care of her that night got panicked, called 911. 911, their purpose is
To save.
the person.
Yeah.
So therefore, you almost have to walk in their faces. You shouldn't call 911 because you are asking them to do something that is against what their whole point is. My mother-in-law, as a consequence, not 3 weeks later, had to go through the same thing. It broke my heart. I was so angry at that one young woman. I thought, you were trained to do this. That's what you were paid to do. You were trained. Why did you do this to her?
Yeah.
So remember that there is that possibility that if you don't make absolutely certain that you understand, and in this case, she was 94,
Yeah.
and it was going to happen sometime,
Yeah.
but she had to go through the whole thing again.
That's
And it
terrible.
so
Thank you for sharing that, because I think it's having that perspective that really gets you to think about. I think all of us want to live forever, and we want the people that we're caring forever to live forever, but that's just not a reality. And is it going to be worse?
I have a question.
Yes.
So this is, looks like a California Medical Association approved form?
It's a copy.
Okay.
Yeah, this one is actually a copy.
Is it valid for VA or Navy hospital?
That I don't know. You might want to check with the VA, but you could still ask them for their DNR form. What I would suggest is that, see, if you see at the bottom, this is why I say, so just want to make sure you understand, this is just a copy for our class purposes. The healthcare directive, you can get it notarized and it can be working today. This one, if you can see, it's a triplicate. So it comes in a actually, there's 4. White copy, yellow copy, triplicate, and pink copy. So you would have to get this one from your doctor. So it stands to reason that if you go to the VA and you ask them for a DNR form, that they could give you one. It might be the same.
Where
But
can you get them?
with your physician at the doctor.
The only place you can get it.
Yes, because they have to sign it.
Okay.
Yeah, see, a hospital. You get it from the hospital.
So you only get it when something severe happens? Like
No,
that?
you can get it before. Yeah,
You need to do it.
before. Yeah. You would get it before to be prepared so that if it did happen, they already have it on file and it's been signed and the doctors know.
So just kind of getting back to maybe your situation, if couple of EMTs show up because somebody panics and calls,
Yep.
knowing that a DNR is in place, you have to put this form in front of their faces and to get them to back off?
Yes, which is contrary to the purpose of them being there.
Right, but
That's
they,
right.
they are trained to at least recognize this form?
They are, and we're going to talk about another one that I'm going to share that might help. But yes, and that's something you need to consider.
Right.
When do you call 911?
Right.
When do you not? So if the person is already towards their end of life, right, and maybe they've decided to do hospice at home, and now it gets to the point where the person is getting to the end of their life, do you want to call 911 or should you call the hospice nurse? And maybe the hospice nurse can walk you through the oxygen and through the, the pain medicine and that kind of thing. So, okay. So talk to your doctor, keep a copy of the medical record, talk to your family and close friends, include in your advanced care directive. These are all places where you can keep them. But again, what we were just talking about, if you do not have a DNR, healthcare providers will do everything possible to save your life or the life of the person that you're caring for. So if that's what you want, then just, think about that. Okay. Alternate names, just in case you hear about these names in the hospital: DNR, end of life, do not resuscitate, allow natural death, no code, so you know what they mean in case they mention those, okay? Okay, so I wanted to include this because California, for the last 25 years, believe it or not, has been talking about the option of giving Californians, kind of death with dignity. You've heard that. I think Oregon was the pioneer in getting this enacted. But it is an option there for people who are terminally ill. Yeah, it did start 25 years ago, but it became law in California just in 2015. And I don't know if you remember a woman by the name of Brittany Maynard. She was a young woman who had a terminal disease, and she went to Oregon to try to get the End with Dignity Act applied to her. And so she kind of became the face, the advocate of this law. And because of that, it was passed in 2015. So what it means in a nutshell is Californians who are terminally ill with less than 6 months to live can end their lives in a humane and dignified manner. Okay? It also, later on in 2018, I'm giving you these dates because look at how recent. 2018, September of 2018 actually, the Penal Code was updated or upgraded to say that actions undertaken under the End of Life Option Act, which is what it's called here in California, are exempted from persecution. So doctors are not going to be prosecuted if they help with this option. And the reason why I wanted to mention it is because a lot of us as caregivers sometimes end up caring for someone who has a terminal disease, you know? What happens there? I mean, the person has to have mental capacity. So a lot of times it doesn't apply to people who have memory loss or Alzheimer's or dementia because the person has to do it on their own. They have to request it. They have to actually let some time pass, which is about 15 days, and then request it again. The physician has to agree and then has to get another physician to agree. There are a lot of mechanisms in place so that the person is the one that is making the ultimate decision and nobody else is interfering. But the reason why I wanted to mention it is because I've talked to a lot of caregivers who sometimes have this, you know, dueling just question, what do I do? What do I do for myself and what do I do for the person that I'm caring for? So then it's really, it's an option that you could talk to your physician about. And you can, also your physician might say, I have a hard time with this law. And I don't know if I could be the best person to implement it. Then right there, that leads you to understand that maybe I need to look for somebody else. So remember, this is about empowering you to make ultimate decisions that are going to affect your health care, your end of life. Okay? Okay, so POST. POST looks like this. Thank you. Except this pink, yes, and I put it up there here in the PowerPoint. So this one you get from your physician. And what it is, it's a physician's order for life-sustaining treatment, or POST. Every state has a different color, or bright pink. And it's done like that so you can kind of stand out in your file so they can see it. These are conversations that you're going to have with your physician. So there's a lot of conversations that you're going to be having with your doctors, right? And it really, what it helps you do is come up with how your life treatment options are going to look like, okay? Especially towards end of life. So it should be completed by both the doctor and the patient. So if the patient is you, then you need to complete it. If the patient is the person that you're caring for, then that's who needs to complete it. It gives seriously ill patients more control of their end-of-life care. It also is voluntary. You don't have to do this, but if you do, I would encourage you to keep these together. Right? We're just adding to the little file packet that we're going to carry with us and that we're going to give our doctors. It does not replace the Advanced Healthcare Directive. And I wanted to say that because the questions are very similar. If you take a look at the form, the POST form, it talks about, you know, CPR. Do we want it? Do we not want it? Right? Medical intervention. Do you want full treatment? Do you want, let's see, intubation? Do you want artificial the nutrition? Selective. Do you want only comfort focused? If you can just go down, these are you know, just very simple questions. You even fill out, you can just check off the box. And it also talks about including the signature of the patient, signature of the physician, and also if you have an advanced healthcare directive. So it just makes it more specific for the doctor, but it doesn't replace it. Questions on that? Nope. Okay. All right. So here's just a little brief rundown of what it is. So Section A talks about CPR, Section B, medical intervention, Section C, artificially administered nutrition, Section D, information and signatures. I'm so glad that the forms are so simple, given that the topic is so heavy, right? I mean, these are really difficult decisions, but at least the forms are very easily completed, I guess. So what it does, it can prevent unwanted or ineffective treatments. No, I don't want intubation, so don't even go there. Reduce patient and family suffering, right? Because sometimes you have this dueling situation where family says, yes, intubate. No, don't intubate. Hey, agent here, we already have a form, and this is what it says. This is what we decided. And it ensures that patient's wishes are honored, which is ultimately what we all want. Okay, vial of life. So you all have one of these, and these are really great visuals. Let me show you what they do. So it's a vinyl plastic envelope that you put, well, let me see, just put it aside for a little bit. But it has a form inside. I know it's a lot of paperwork, but it's necessary. And if you look at it, it's very simple, right? Name, address, social security number. Are you divorced? Are you married? Who lives in the home? Do you have pets? And the reason, and then on the back is all of the medication that the person is taking. And what this does is if medical personnel team, EMTs, come into the home, you would put this on the inside of the door jamb. So just right there's a sticker that indicates to them, go to the refrigerator, it's got a magnet, and they would grab this form with all of your information and take it if they're taking you to the emergency room. Because then this shows them, oh, they're allergic to penicillin, they're taking these medications, oh, there's a cat in the house, somebody needs to feed it. Or dog or whatever. Here's the emergency contact. Let's call that person. Hey, we had to take your mom. She called 911. She's at this hospital. And, somebody will look at this and look at it that way. What I recommend is putting a picture of the person who this applies to. Because what happens if you have two of them in the refrigerator? Right? Who are we? There's two women or there's two men. I don't know. Or there's 3 or 5 and only one. I don't know who this is.
So this form applies to anyone who you think might need. Like my daughter has MS.
Yes. So then let's say you would do one for your daughter, and you would complete it for your daughter, and you would put this sticker on the door jamb, so that if you had to call 911 or she called 911, let's say she fell or something happened. Then they would come in and they would know to go to the refrigerator and take this with them as she gets admitted into ER. But having that picture helps, so that because then if it's, let's say it's you and her, well, who is it? I don't know.
Has anyone discussed where else you might put it if you have a stainless steel refrigerator?
Have a book.
Put tape on it.
Yeah, but in other words, how do you indicate where that is?
On
Because
that
if you put
They know it's on the refrigerator.
No, but you can't put it on the refrigerator because it won't stick.
Even with a piece of tape, it won't. Just put it.
Just they sell these what are they called? It's like Velcro, and you can pull the back and it leaves it. It's like a sticky tape, but it doesn't ruin your wall. So you could put it on your refrigerator, and you can buy one of those.
Good idea.
Yeah, yeah.
If you were going to change the location, you could put it on the sticker.
Yes,
Door jamb.
yes. You could put it in like red lettering and say, check the whatever, whatever it is. Yeah.
So we all need more than one of these.
Yes, absolutely. If there is the likelihood that if 911 gets called and no one else is going to be there, yes. Or if there's a let's say you hire a caregiver for the person that you're caring for because you're here in this class, and something happens and they call 911, then that person needs to say, here, go take that, go take this with you. This is also important to maintain updated because medications change. Maybe emergency contacts change. So what I would suggest is to make a lot of copies and just keep it current.
more that'll fit in there, then, but it fits his medications just fine. So all I have to do is grab it, and I'm ready to go.
Good.
I've heard about something like that.
It has a combination lock on it that you
Well, but the
can.
fire, that you can, I think there's
Mm.
something, I just remembered when you said that, but there's something that is available from the fire station that you put on the door and they can unlock it. Yeah, something like that.
Okay.
It's just a little lockbox.
Yeah.
Lockbox
Yeah.
that you can carry. I mean, it's like a little suitcase, but it's only
Yeah.
smaller than my purse. I mean,
Yeah. So it's important to also share this with people who might be coming to your home so that they know if something happens, this is what they would need to take it. Okay? So this is, it just helps law enforcement. It helps paramedics, firefighters, if they have to rush into the home. It also helps if you have to evacuate and this is left in the thing in the refrigerator, and they come back and they might say, oh no, there's an animal, there's a pet here that needs to be taken care of, or there's certain medication that needs to be taken. Okay, so just super quick, because I know we're already at our time. These are all of our services that are available for family caregivers. If you haven't connected to our organization, everything we do is free. We're here for you. You don't have to do the caregiving role alone. It's not easy. It's very challenging, and we're all human. So we are doing the best you can, right, as caregivers, but you can do it with knowing that we are here with resources, with assistance, with really to listen to you. I mean, we'll even offer counseling for free for caregivers. I do want to make a point to show you there are 2 flyers that if you haven't taken already, please make sure you take. One is an upcoming conference that's scheduled for March 8th. It's for military and veteran families who are caring for someone with a traumatic brain injury, some sort of disability, physical disability, or PTSD, post-traumatic stress disorder. And then we have a list of classes that we're going to be holding here every month. And you're just like this, so you're welcome to bring a friend, come on over. If you decide, next one I'm not that interested, but the one after I am, just let us know so we know how much coffee to make. So we know how many chairs to put out, that's fine. And we welcome you. If today, before you leave, you want to connect more to our services, how many of you are caring for someone who has dementia, Alzheimer's, or memory loss? I encourage you to talk to my colleague Rosario here because we have a wonderful program that's specific for caregivers who are caring for someone that have those conditions. And it's wonderful because you learn more about the disease, how to manage those behaviors. Do you know what I'm talking about? And how to do self-care, which is so important.
and you need to go to their support groups to do that. And you also need to take the REACH class.
Thank you. So she said that on her own.
The REACH class is wonderful because it's 4 times in 1 month, and you go once a week, but it helps you to calm yourself and be able to take care of situations.
Thank you for sharing that, Liz.
And you get a book.
And you get a book, right? And you party at the end.
You party every time they give you that.
Yes.
Any of your services cover long-term care insurance?
We actually, one of the services that we do, where is it? Legal and financial. We do work with law firms and elder law attorneys that can help you answer those questions, and we'll pay for that initial consultation. So you can have all of those questions about how to cover long-term care. What do you need to do to cover long-term care? And they will give you tips and suggestions on how to do that.
So you're talking about if you're interested in purchasing?
It doesn't have to be purchasing. It could also be what's available through Medi-Cal, Medicare, etc.
Okay, but how about,
If you wanted to purchase,
actually we've purchased
okay.
already and we'll be using it soon, but it was a real battle. Oh, we went through so much with, and I just wondered if that service was, if that kind of service existed, we had to pay someone, we had to pay an advocate to help us, otherwise we wouldn't have made it.
Huh.
We would have given up a long time ago.
I know our elder law attorneys are really good at kind of going through and separating what is available for you and what you can.
This advocate.
Okay.
is the one who
Oh, good.
Yes.
Oh, good.
It's expensive.
Well,
So
connect
anyway,
with. It sounds like you're already connected with us because maybe there's a way you're not.
I'm
Okay.
under,
Well, she
you know,
paid,
this-
she
I-
paid to have an advocate.
No, but
whereas
I'm saying.
You might be able to help.
Yes, but I'm saying.
That's exactly what I'm.
Yes. So then, if you are a client
Uh-huh.
of ours, then it's easier for us to work with you on trying to figure out what other resources are available. Because we work with a lot of community organizations, resources to try to get you the help that you need. So yes.
You said all of your services are free. How are you financed?
By smiles. Sunshine. We actually get a lot of grants from the County of San Diego. The County of San Diego has recognized us as the lead provider of caregiver services. We get some grants from the state as well as some like federal grants, donations. We figured caregivers are already burdened enough to have to ask you to pay for these services. That's not our goal. So it's really donations and grants. Fundraising. We do fundraising. So if you ever see one of our fundraisers, feel free to reply. Yes. And somebody else had a question here, no?
Oh, I was going to ask you, so medical power of attorney is different from regular power of attorney?
Yes.
correct?
Regular power of attorney is more general, and it talks about more maybe like finances, assets, distributions, whereas healthcare directive is specifically regarding your health care. Yeah.
And if you have a trust, you need a will.
Yes. That helps too, because then you're talking about, and this is where our lawyers come in, because they can help you with those. If you're at the point where you're like, I need to talk about a trust and a will, this is where they can come and help you sort that out, and we can pay that initial consultation. Yes.
Is there a power of attorney that encompasses everything, financial and?
Yes, it's a power of attorney, general power of attorney. Yeah, but it's very general. This one's very specific, as you can see. I mean, it gets into very detailed end of life, life-sustaining measures. The other one might be more general, but it could also be, if you're going to be more specific, then you might try to get a trust or a will. I want this to go to this person. You know, I want to disband this. I want to divide that in terms of assets.
I went to a seminar here a week or two ago, put on by Sharps, and we thought we were set because we have a trust, okay? I mean, it maybe needed to be updated, but they also said you should have a pour-over will referring to the trust. And so it's like, okay, now I gotta do that too, so, I mean, but there's a lot of stuff that's,
Yeah,
you
it's
know,
a lot.
that's why getting legal representation sometimes is better
And we'll pay
than
for it.
going through her.
Yes, go through us.
And
Yes.
I want to share, since we're talking
Yes.
about trusts. I'm my husband's caregiver, and we just had our 3-year visit with our attorney, and because my husband's dementia has been declining, my husband has been removed, or actually the attorney asked my husband, Glenn, do you want your wife to make all decisions, which means that we will remove you as a trustee from the trust? And not, it seems like, I've been telling friends about this, and it's not, common knowledge for people to know that, and you could be in a huge bind if
Yeah.
we didn't release his name.
Yeah.
Yes, so just a word of caution if it's, because it's my husband and myself on the trust.
Yeah.
And so he signed the release form, so he's not a trustee, so I will be making all the decisions, but,
Yeah.
it's
That's good to
pretty
see. Yeah.
scary if
Yeah.
we hadn't done that important decision.
You're lucky because my husband has Alzheimer's and it's gradually getting worse and worse, but he would never give up.
Oh, I heard of that too.
That's
We
hard.
did the same thing for my mother-in-law, so
Mhm.
my wife is now making all the decisions.
Decisions,
So,
yes.
That's where it might be helpful for you to go onto the internet and look under conservatorship, and whether or not the person is able, because there are certain questions that you ask having to do with reasoning ability.
Yeah.
Is the person able to do this without assistance? Well, that's where it may come up.
Honey, he's driving.
That's a different class that we're going to be having.
My 92-year-old dad just bought a new car,
Well, I know,
unbeknownst to me.
but it's the
Really?
reasoning ability.
Is it a convertible?
To be able to laugh about it.
Wow.
Yes, my husband is so agreeable and, you know, whatever the attorney says.
Thank you.
Well,
Yes,
there's,
he
there's
says, "Oh, yes."
liability, there's liability.
Oh,
And
Thank you.
that's,
Yes.
if